Hello, everyone. It's Wednesday, October the 20th. I don't know how, is there any way good to say this? Since Monday, we've lost an additional 85 people. I say it and say it and say it and say it. We should absolutely do what I say. We should be very respectful of others, and we should be neighbors, loving neighbors, but at the same time, more and more and more of us ought to go get vaccinated. And we ought to try to learn more about it, and we ought to ease our fears as best we possibly can. And without any question, one thing is absolute for certain. And that is the more of us that are vaccinated, the less will die. But nevertheless, the 4,135th death is a 64-year-old male from Wood County. The 4,136th death, a 50-year-old male from Kanawha County. The 4,137th death, a 41-year-old female from Kanawha County. The 4,138th death, a 32-year-old male from Wood County. The 4,139th death, a 74-year-old male from Kanawha County. The 4,140th death, a 75-year-old male from Kanawha County. The 4,141st death, a 54-year-old female from Wayne County. The 4,142nd death, a 74-year-old male from Cabell County. The 4,143rd death, a 46-year-old female from Hancock County. The 4,144th death, a 82-year-old female from Putnam County. The 4,145th death, a 62-year-old female from Putnam County. The 4,146th death, a 48-year-old female from Mineral County. The 4,147th death, a 49-year-old female from Logan County. The 4,148th death, a 45-year-old male from Cabell County. The 4,149th death, an 83-year-old male from Upshur County. The 4,150th death, a 62-year-old female from Upshur County. The 4,151st death, a 65-year-old female from Brooke County. The 4,152nd death, a 52-year-old female from Marshall County. The 4,153rd death, a 70-year-old female from Monongahela County. The 4,154th death, a 43-year-old male from Lewis County. The 4,155th death, a 52-year-old male from Fayette County. The 4,156th death, a 90-year-old male from Randolph County. The 4,157th death, a 65-year-old male from Putnam County. The 4,158th death, a 76-year-old male from Grant County. The 4,159th death, a 41-year-old male from Kanawha County. The 4,160th death, a 28-year-old male from Kanawha County. The 4,161st death, a 79-year-old female from Fayette County. The 4,162nd death, a 56-year-old male from Jefferson County. The 4,163rd death, a 69-year-old male from Preston County. The 4,164th death, a 62-year-old female from Monongahela County. The 4,165th death, a 92-year-old male from Tucker County. The 4,166th death, a 65-year-old male from Berkeley County. The 4,167th death, a 72-year-old female from Fayette County. The 4,168th death, a 52-year-old male from Wood County. The 4,169th death, a 103-year-old female from Fayette County. Bless her. The 4,170th death, an 83-year-old male from Raleigh County. The 4,171st death, a 61-year-old female from Nicholas County. The 4,172nd death, a 92-year-old female from Nicholas County. The 4,173rd death, a 93-year-old female from Hancock County. The 4,174th death, an 80-year-old female from Wood County. The 4,175th death, a 50-year-old male from Jackson County. The 4,176th death, a 54-year-old male from Jackson County. The 4,177th death, a 21-year-old male from Jackson County. The 4,178th death, an 86-year-old female from Tucker County. The 4,179th death, a 34-year-old female from Lewis County. The 4,180th death, a 70-year-old female from Kanawha County. The 4,181st death, a 74-year-old female from Wood County. The 4,182nd death, an 80-year-old female from Marshall County. The 4,183rd death, a 62-year-old female from Jefferson County. The 4,184th death, a 56-year-old male from Kanawha County. The 4,185th death, a 65-year-old female from Upshur County. The 4,186th death, a 69-year-old female from Marion County. The 4,187th death, a 72-year-old female from Marion County. The 4,188th death, a 56-year-old female from Wood County. The 4,189th death, a 44-year-old female from Mason County. The 4,190th death, an 85-year-old male from Wood County. The 4,191st death, a 68-year-old male from Monongalia County. The 4,192nd death, an 84-year-old male from Preston County. The 4,193rd death, a 71-year-old male from Braxton County. The 4,194th death, a 52-year-old male from Greenbrier County. The 4,195th death, a 54-year-old female from Hancock County. The 4,196th death, a 51-year-old female from Marshall County. The 4,197th death, a 72-year-old male from Wayne County. There's 22 additional deaths that are reconciliation deaths. The 4,198th death, a 67-year-old male from Upshur County. The 4,199th death, a 79-year-old female from Kanawha County. The 4,200th death in West Virginia is a 97-year-old female from Wayne County. The 4,201st death is an 80-year-old male from Ohio County. The 4,202nd death is a 73-year-old female from Cabell County. The 4,203rd death is an 82-year-old male from Marshall County. The 4,204th death is a 49-year-old female from Cabell County. The 4,205th death is a 43-year-old female from Marion County. The 4,206th death is a 39-year-old male from Hardy County. The 4,207th death is a 49-year-old male from Randolph County. The 4,208th death is a 62-year-old male from Barber County. The 4,209th death is an 80-year-old male from Clay County. The 4,210th death is a 33-year-old female from Harrison County. Is this correct, Jordan? You know, that there's two 33-year-olds right back to back in Harrison County? We're going to double check this, but my notes say the 4,211th and the 4,210th death are 33-year-old females from Harrison County. That doesn't seem exactly right to me. The 4,212th death, a 97-year-old female from McDowell County. The 4,213th death, a 91-year-old female from Jefferson County. The 4,214th death, a 94-year-old female from Monongalia County. The 4,215th death is a 56-year-old female from McDowell County. The 4,216th death, a 63-year-old male from Mingo County. The 4,217th death, an 89-year-old male from Brooke County. The 4,218th death, a 93-year-old male from Nicholas County. And the 4,219th death, a 66-year-old male from Boone County. We'll let you know if that was a duplication and we are at 4,218 or 4,219 deaths. It's a lot of great West Virginians. We're down to 8,469 active cases. That's better. Our daily positivity rate is 6.5%. That's better. Our cumulative rate is at 6.07. There's over 250,000 recovered West Virginians from this dreaded disease. There's 714 hospitalized, 211 in the ICU units, and 128 on ventilators, and that's down a little bit. We have 4 green counties now, 40 school outbreaks in 18 counties, 602 confirmed cases right now. And we have 2 counties that still aren't wearing masks, and that's, that's their local decision. That's Pocahontas and Tucker counties. I remind everybody again, 65 and older, if you have any symptoms, I was feeling a little tough on Monday and got tested negative. I think you should take advantage. Take advantage of the free testing. The antibodies are waiting on you. If by chance you were tested and tested positive and everything, we could probably save your life. I encourage you, if you're in a big crowd of people and you've got, compromising issues, diabetes, lung conditions, heart conditions, you're 65 and older, you ought to really consider wearing a mask. All the booster shots are available. Anybody that's age 18 and above ought to be getting your booster shot. If you're Pfizer, if you took Pfizer and you're 6 months out, if you're fully vaccinated and you're not getting your booster shots, you're not being smart. That's all there is to it. You should absolutely go get that booster shot. We've got all the shots available and we're working on it like crazy. I don't have you an update on Moderna. It looks like Moderna is going to come out. It can all change, that. But indications are for 65 and older with compromising issues, that's the way it's going to maybe ease out in the beginning. We're up to 66.1% of the 12 and olders that have been vaccinated, 81.6% of the 50 and olders, and 91.8% of the 65 and olders. All the vaccine eligibility, I've said it 1,000 times, is for anybody above 12 years of age or 12 and older. I encourage our young people to get vaccinated, but at the same time, we need the help of our parents. And we need the help of our grandparents and grandfamilies. Our grandfamilies can take advantage of this $150 school voucher and try to help us towards getting those 19,000 kids that you've got vaccinated. All the information on our COVID vaccine info line is up there. All the stuff about free testing. Again, I always want to thank Fruth and Walgreens for all the great work that they did in the beginning and still continue to do. Our flu vaccines are available to anybody, and you can take them at the same time that you're taking your COVID vaccine. I remind everybody about this rental assistance program, especially, our renters and landlords. Please look into that. And if you're having an issue or a problem, get in touch with us and see if you qualify for some of these dollars. We've still got a lot of dollars that we could be sending out right there. And the only other thing I've really got is tomorrow we're going to kick off our fall trout stockings, and and I'm going to be making an announcement tomorrow at 11 a.m. I think I encourage everyone to tune in to that announcement and everything, but at 11 a.m. tomorrow, and it's a wonderful time of year. My gracious sakes, living. The colors are just starting out, and they're beautiful beyond belief. And our waters are in pretty decent shape, relatively low, I'm sure, but pretty decent shape. But we're going to make a gigantic announcement on a beautiful trout stream tomorrow that we're kind of bringing back and into the program and everything. And I think you really like it. 11 a.m. tomorrow. That's all I got. Oh, I got one other thing. Okay. There was really only one lady which is terrible beyond belief. It's 33 that died. It's just, I don't know how in the world you can make anything good out of this. So we have 4,218 deaths, but please don't let these people just a number. Crying out loud. Don't let them become a number. And so, all right, thank you.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Good afternoon. In support of what the governor has said and does every press brief, we know that the death numbers are really mounting up, not only in West Virginia, but also in our country and our world. You know, we've lost more than 4,200 great West Virginians, more than 700,000 Americans, and almost 5 million world citizens to COVID-19. We know in West Virginia of our current number of deaths that 225 deaths are people that have been fully vaccinated and everybody else has not been vaccinated. So this really does reinforce the benefit of having full vaccination. We know that in other countries that have really made great headway with COVID-19, they are very much fully vaccinated and boosted. The country of Israel has done booster vaccines in all Israeli citizens 12 years old and over. And they've also been smart about their testing and about mitigation measures, which includes, as the governor said, to wear a mask if you're indoors around other people that you don't know and that you're at risk. As the governor also said, the FDA has made recommendations on the Moderna vaccine. Remember, this would be half the dose of the first 2 shots related to the booster for Moderna. And that will be heard in front of the Center for Disease Control's Advisory Committee for Immunization Practices. And at least at this point, it looks like that the indications may be very similar for the Pfizer vaccine and for the Moderna vaccine. Another update that's important is that for the Johnson & Johnson vaccine, the FDA has decided that anybody who is 2 months or greater from their first shot of Johnson & Johnson should consider getting a second shot. And this second shot it looks like, could be a combination shot with a Moderna or a Pfizer vaccine, or with another Johnson & Johnson vaccine. And that hasn't been cleared yet. It hasn't been authorized by the FDA or the CDC, both of which need to sign off on that for that to become the standard, the guidance. But there was a study done by the National Institutes of Health that showed if you got a first Johnson & Johnson vaccine and your second vaccine was Moderna, 13 days after that second vaccine, they saw a 76 times increase in antibodies that were effective against COVID-19. If your second shot was Pfizer, they saw a 35 times increase in antibodies against COVID-19. If your second shot was Johnson & Johnson, remember this is all after a first shot of Johnson & Johnson. If your second shot was Johnson & Johnson, there's only a 4 times increase in antibody levels. So it does appear that taking a second shot with a messenger RNA vaccine, Moderna probably greater than Pfizer, will give you more antibodies, at least at 13 days, than a second shot of Johnson & Johnson. That will also be discussed. The only other thing that I wanted to bring up is as we look around the world and look at places that are having new issues with COVID-19, I want to call some attention to the United Kingdom. The United Kingdom is starting to see their cases spike up again, and that's as they have lessened their discipline as far as mitigation and testing. But they're also seeing a new variant of the Delta variant, an additional couple of mutations in the spike proteins. Remember, the spike proteins are where the virus binds to our cells. That's also where the antibodies, the immune factors, recognize and bind and cover up, neutralize the ability of the virus to get into cells. So these antibodies recognize the spike proteins. That's where the vaccinations are against. And although this new variant called Delta Plus has not taken over from the native Delta, it is slowly growing. So it is something worth watching for. Many experts, including Scott Gottlieb, who was President Trump's FDA commissioner for 4 years, has also been tweeting about this, as have other experts. So this bears watching, but it does reinforce the idea that not only is vaccination important to prevent severe side effects of COVID-19, but also very important to prevent spread. Thank you.
Thank you, Dr. Marsh. Next, we'll hear from Dr. Ainam Jad, our State Health Officer.
Good afternoon. We have gotten some questions about quarantining and vaccination, so I just wanted to give a quick reminder about that. If you've been fully vaccinated and you've been exposed to someone with COVID-19, you don't need to stay home or isolate or quarantine unless you're having symptoms. So fully vaccinated individuals, you don't need to stay home unless you're having symptoms. And then we do recommend, you do get tested 3 or 5 days afterwards. Now, if you have not been vaccinated yet and you have been exposed to someone with COVID-19, then you do need to stay home for at least 14 days, and then also recommend to get tested 3 to 5 days afterwards to make sure you don't have COVID. But those are the recommendations. You can see those on our website as well as CDC. And we do want to remind everyone that we have free testing sites still around the state, and we do recommend that you please utilize those. But we still get those questions a lot. But those are also on our website and also on CDC's website about those recommendations. Thank you.
Thank you, Doctor. Secretary Bill Crouch is also joining us today and is available for questions. Retired Major General Jim Hoyer had a prior engagement, and he will rejoin us next week. We'll now go to questions from members of the media. The first today from Paul Mullen with WCBC. Paul, you may be muted. All right, Paul, we're having a connection issue there. We'll go next to Charles Young with WV News.
Hi, this is Charles Young with WV News. I was wondering if anyone could give us an update on the situation at the Veterans Nursing Facility here in Clarksburg. Is there any new information on that outbreak? Thank you.
Maybe who? Yeah.
I can, Governor.
Okay, Dr. Armstrong, please.
Sure, Charles. So right now there's nobody in the hospital. There were a few patients in the hospital. Unfortunately, there was one patient that did pass away. There's 5 staff right now that are have COVID, and they have about 11 patients that are with COVID right now as well. But they did have all antibody treatments, which did help a lot. Other than that, they're doing well, and they did have sanitation done with the National Guard and help with some isolation, setups and things like that. But so far, they're doing well with that. But that's the status right now at the long-term care up at Clarksburg. Thanks.
All right, thanks, Charles. Next to Mark Curtis with Nexstar Media. Paul, I'm sorry, Mark, I think you're muted too.
Sorry about that. I'm all thumbs today. Governor, as you know, the bill barely passed the Senate last night to create those exemptions for people with religious or medical reasons not to get the vaccine. It's going to the House tonight. Why do you favor this? A lot of the Democrats and even some of the Republicans feel like this is an overreach into private business, particularly hospitals that have a vested interest in keeping all their employees healthy and safe and vaccinated so they aren't either catching it or transmitting it to patients. Your thoughts on the exemptions and why you're behind it?
Well, Mark, I had a whole bunch of discussions with the legislative leaders and everything, and I was encouraged, to move forward with my thoughts about the bill, but nevertheless, my feelings are exactly the same. I feel very strongly about the fact that we've pulled the rope together. We've been through this whole process. I've said it over and over and over, but I surely to goodness don't want to be infringing upon businesses and their feelings and their beliefs and everything. But at the same time, we do have to follow the law, and the law clearly says, in my opinion, the way I see it, is that people that that we do have to make exceptions for, people that have medical conditions or people that have religious beliefs, and that's the law, Mark. And all I was trying to do is clarify, because I hate like crazy to see someone losing their job, when they do have a legitimate exemption, whether it be medical or religious, and I felt like that was the right move to try to keep us all pulling the rope together.
All right, thank you, Mark. Paul Mullen, I believe we've reestablished connection.
Good afternoon, Governor. Good afternoon, everyone. My apologies for being all thumbs as well. I wanted to go to Secretary Crouch and Dr. Amjad with a question about the general health of West Virginians. Obviously, during the pandemic, the emphasis has been on COVID-19, and now the flu season coming up, and also the opioid crisis as well. That's a heck of a triple header. But I know there's been some concern that people that needed treatment for other existing conditions have not gotten that treatment because of the pandemic. Are you hearing reports of that from the field? And maybe what are your specific concerns with regard to other potential illnesses? Thank you.
I think Dr. Marsh, maybe you can do this. Can you do this, sir?
Sure, I'm happy to start, Governor. Maybe I'll hand it to Secretary Crouch and Dr. Amjad too. Thank you, Paul. We know that West Virginia continues to be challenged with the opioid pandemic. We've seen an increase in the number of overdose deaths since the COVID pandemic has been upon us. We are also very much concerned about the dual problems of influenza with COVID-19 coming up with the winter season approaching, which is why the governor and all of us have been so consistent in saying that people should really get their influenza shots, their flu vaccines, as well as be fully vaccinated and, if eligible and the timing's right, get boosted for COVID-19. We also know that there are many other health problems that West Virginia faces and many other challenges, but we are very optimistic that the resilience and the commitment and collaboration that, as the governor said, that we've used to pull the rope together and run to the fire can be used as we continue to focus on improving the health of West Virginia residents, not only from COVID-19, but under the governor's guidance, really promote the well-being and the health of our residents. So Bill or Ein, other comments?
Yeah, thank you, Clay, and thank you, Paul. I've talked before about when I took this position, one of the things that I intended to tackle initially were some of those areas that West Virginia ranks poorly in: cardiovascular disease, obesity. We have high rates of diabetes in the state. This pandemic has slowed our efforts to do that, but it has not stopped our efforts. We're looking at some areas right now that involve some data reviews. We're very concerned about the southern part of West Virginia, where we have counties that have high mortality rates, higher than the state average, significantly higher than the state average. So we are beginning to focus again on those issues. This pandemic has caused a lot of folks to put off care that they've needed for non-pandemic reasons. And hospitals have experienced a lot of that. So we want folks to get back to normal. We want to try to really hone in on some of these areas that are a problem in West Virginia, and we are going to make progress with this. In fact, Dr. Marsh and I have had these conversations for the last few years now. How do we tackle some of these big areas in the state? So you'll see some things in the coming months that we're working on to try to fix these problems and improve the healthcare in West Virginia. So great question. Thank you, Paul. Anh, you have anything to add to that?
Just a couple of things. A lot of the news media focuses on COVID this past year, but we've had other organizations working very hard as well. There's a Governor's Council on Substance Abuse, a Tobacco Task Force, the minority organizations. So there's a lot of other people who've been working behind the scenes that maybe doesn't get a lot of media attention because of COVID, but there's a lot of people in the state that have been working hard alongside with us that, COVID has taken the scene, but they're helping the state as well alongside with us. So that's been going on as well, helping. That's all. Thanks.
All right, thank you, Paul. Governor, I'll turn it back to you.
Well, I tried to clean up this situation about, beautiful lady that died, is 33 years old and from Harrison County. and there was only the one death. But I guess we'd left off that there was the 4,211th death was really a 66-year-old female from Braxton County. The total number of 4,219 was correct, but I did want to mention this other beautiful lady, 66 years old from Braxton County, that passed away. Other than that, really, I really don't have anything else today except I just continue to encourage on vaccinations, and I would continue more than anything to encourage your prayers. Your prayers will help really get us through this, or will get us through this. And so, you know, as we continue to pray for all those that we've lost and all their loved ones, please, again, over and over, I say, don't let them become a number. They surely have given too much to end up just being a number. So thank you so much. That's all I've got.